Namaste Andy. I am Dr. Krishna Subramanyam, Senior Consultant Orthopedic Surgeon, working in Yashoda Group of Hospitals, Malakpet. I am an arthroscopy and arthroplasty surgeon, and I have been practicing in the last 28 years in Hyderabad. Almost every senior surgeon does. In the last 4 decades, many of the patients got the benefit because of the knee replacement surgeries. When we do these knee replacement surgeries, whenever the patient, because of various reasons, because of the age or because of the injuries or because of other causes like inflammatory arthritis, when the knee joint gets damaged, the damaged joint surfaces are replaced with new knee implants. And that makes the pain to go away completely, and the patient's limb becomes straight, and a patient is able to bend the knee comfortably, and he or she is able to do her routine activities day in and day out. And many of the patients lead near normal life, including car driving, stair climbing, etc. But what is new about the knee replacement now these days? As the technology comes into the medical fraternity also, many innovations have happened in the last 2.5 decades. For example, from the regular knee replacement, we have moved to navigation assisted knee replacements.